遇见有趣的灵魂，活出真实的自己。大家好，欢迎来到谈心社，让我们一起谈心、谈情、谈音乐。Welcome to Generous Talk, an intercultural conversation on music, health, and lifestyle. Enjoy. Hello, everyone. Here's our literature uncovered number 2. I'm Xingyu.
And I'm Timothy Cole.
Today we're going to talk about how to reduce pain without side effects.
What are some alternative ways to manage pain besides using medication?
The answer is music.
Exactly. But how specifically? And that's what we're going to talk about today as we look at this study about neonatal infants in the NICU. Okay? So, without further ado, let's get into it. So, what we have today is a study called Singing, Sharing, Soothing Biopsychosocial Rationales for Parental Infant Directed Singing and Neonatal Pain Management, a Theoretical Approach. That is a mouthful. That is a mouthful.
Yeah.
But pretty much, yeah, it's everything is right in there. So this study is all about pain management for babies in the NICU, which is pretty much the NICU is the neonatal intensive care unit. And it's for premature babies and helping them to survive, when they're born early. Now, the issue in the NICU is that for babies to have a higher chance of survival, there's a lot of painful medical procedures, very invasive medical procedures that they have to go through. And often this involves, there's a lot of things going up, their nose, there's a lot of needles going in, a lot of puncture of the skin. And as you can imagine, this is very painful for an infant, just like it would be for an adult or a child or a teenager, right? So some issues that, parents and infants face in the NICU is, for one thing, the infant-parent separation, right? So that's a big issue, is that the babies have to be kind of like in isolation as they're being treated. So parents, at least for now as a standard, are not typically allowed to have too much interaction with the baby because any kind of really spike in energy can make them use up calories that they really need to survive, right? And then there's also just the cumulative procedural pain that comes with all these procedures that babies they're kind of building up like all of this pain. Apparently they found that it's actually cumulative, and the pain itself is not adequately treated. And then this can also lead to long-term psychological and physical effects and issues, right? And could actually, yes, exactly. And can really result in an increased risk for heightened sensitivity to pain for the infants, right? So what this study is looking at is really what can we do about this pain management, about dealing with this pain for these infants without loading them up on more medication, right? Without doing more invasive things, because they've already got all these invasive procedures going on, right? So one thing that's being suggested is music therapy. Which already in the US, there's plenty of music therapists in the NICU, and that's actually a specialization as a music therapist that you can have. You can be a NICU music therapist.
Yes.
And this study, I believe, is actually in Scandinavia. So in Scandinavia, they're really trying to push more music therapy in the NICU. And specifically in this study, they're talking about a music therapy method called PIDS. That's PIDS. PIDS. Cute. I like it, right? And that's Parent-Infant Directed Singing.
What does that mean,
which is
really?
So essentially, that's just the parents singing lullabies to their babies. But this whole process of singing the lullaby to the baby is guided by a music therapist. And the idea is that the process of singing to the baby is helping with the pain management, right?
For both the infant and the parents.
Exactly,
That's
for
really
both the
interesting.
infants. Exactly, exactly. So really, kind of the goal here is emotional regulation and pain management. And like Xingyu said, this is both for the infant and the parents. And also because of that, as we'll explore in the study, that being really effective, actually having the parents sing to the babies as far as for emotional regulation and pain management, then there's also a push then for parents to become more welcome in the NICU as a form of prescribed pain management for their infant. Like the parent, is that interesting? The parent can be the prescribed medication. And it's a non-invasive form of medication. Like I think that's awesome. All
Yes,
right.
and as medical field moving more towards this holistic view of treating the human being rather than certain disease, that's what we
Yes,
move
exactly.
towards.
Exactly. This is all happening amidst a big push in NICUs to become more family centered in their care. hmm
Mhm.
And also in the world, we're getting more person centered, more family centered, and, seeing all these positive effects from that, right?
Mhm. Mhm.
So, what's been shown through the PIDS method is that in the babies, there's been an increase in dopamine and oxytocin, as well as a trigger of the endogenous opioid system. And all of these help to decrease pain perception. And this is great because it's non invasive through the multimodal experience of live singing.
Mhm.
Now, what I want to stress right there with what I just said is the multimodal aspect of that. Multimodal meaning it's affecting more than one sense. Okay. So live singing, so there have been studies that have shown that the recorded singing is also effective, right?
Mhm. Yeah.
But the live singing is more effective because not only do you have the hearing, the sensory perception for the brain of the hearing that's helping with the pain management, but you're also having the touch, right? So the touch sense, somatosensory being triggered as well for the release of the oxytocin,
Mhm.
right?
Mhm. I believe
And then
that's
there's also the visual, right? The
uh-huh.
whole visual stimulus, that whole comfort of just knowing, kind of instinctively mom and dad are there, right?
Yeah.
Especially mom. And
And
so,
there's also
oh, go ahead.
movement aspect of that.
Hmm.
Uh-huh.
Yes, exactly. So because of that whole multimodal experience that the infant is having, that's why it's argued and theorized that the live singing is much more effective
Mhm.
just because there's just more being targeted, right?
Uh-huh. And
Um,
also, the parents can look at and sense how the baby respond and then adjust to baby's response. That interaction, they're creating this emotional attunement. I really like that word.
exactly,
Affect attunement
exactly,
to create that interpersonal relatedness and encompass a sense of parental empathetic responses. And
hmm
that's a part when I look at it, because I work with a lot of adults who are traumatized as a child, and so their relationship, their ability to kind of relate to another person was not able to be established in a healthy way. And when they come to my session, I find a lot of what we do in music therapy is through this music interaction to help them to build or repair this affective emotional attunement that they were missing. in their early developmental stage. And I think like reading this research they're doing on baby, and for me like kind of making that connection is like amazing.
Mm-hmm. I think the great thing about, singing is that it's something that can be used, before, during, before a procedure, a painful procedure, during a painful procedure, and after. You don't have that risk or the side effects that come with, taking the medications. When you have something invasive going in, like a medication, there's usually a certain time that you can take it, before or after. And if you miss that mark, then you can't even take it anymore. I'm thinking of specifically, this is just off the wall, but when a mother like has a child, right? I believe that you can only take an epidural. As an epidural, I believe so. Epidural, like up into like a certain point.
Uh-huh.
Yeah, you can take a certain amount, and then also there's a cutoff in timing. You have to take it. I don't know the exact. I'm not very familiar with this, but there is a cutoff time. Any mothers, any mothers who are listening to this podcast, please correct me, or doctors who are listening, please correct me. Teach me something, because I'm not very, very familiar with the childbirth procedures. But yes, I am aware that there's that cutoff, So that's the great thing about the singing, is that really it can happen at any time during a procedure, And so we can really then look at PIDS, because PIDS was so effective with the infants in this study. We can look at how this can really generalize beyond the infants, right? And to, like you said, to anyone who's experiencing pain, right?
Yeah. I think here we're talking about two types of pain that can happen at the same time, but it's really hard to differentiate because you need to bring a lot of awareness into it. I'm talking from my own clinical experience. I have worked with baby in a hospital who just went through those very challenging procedure, for example, like brain tumor removal or heart correction, heart surgery, and physically they are in a lot of pain. And then there's another level, it's this emotional pain of being in an environment that they are not feeling familiar with. They don't feel that grounding. It's not easy for them to feel grounded in the hospital environment with all the machines and beeping and strangers nearby. Also they lost this normal routine, right? And so there's this psychological pain, emotional pain happening at the same time with their physical pain. We talk about developmental and kids, and as well as adults, we need to express and kind of be in a relationship, interact and share with another person to make sense of our experience, make sense of who we are, where do we belong. And in a hospital environment for with kids who are going through these, they lost this sense of normality, those developmental environment and interaction they need to have. So I see music therapies play a double role. We know there are a lot of neuroscience research figure out the mechanics of how physically music can kind of compete with the pain perception neural network, so that it distracts us from the pain physically. And then there's this, we can address the psychological pain at the same time. Yeah. And I also worked with adults who went through surgery, and then they then was sent to they were sent to rehabilitation center, and they were going through a lot of pain during the rehabilitation. They have to do like OT, PT, sometimes speech language therapy, and so they have to endure that kind of physical pain, the physical loss of their like function or body part. And at the same time, they experience this sense of grief of loss, what they used to have. That's emotional, psychological pain. And so for me, I'm fascinated by how we can address these at the same time through like integrating the music, the interaction, the relationship all together.
Absolutely. And what's really interesting is that when it comes to psychological pain and physical pain, the brain doesn't differentiate between the two. It experiences pain in the same way, so whether the source is psychological or whether the source is physical, the brain just recognizes I'm in pain. And you have that stress response, and then too much stress, lowers your immune response, and then next thing you know, you're at risk for getting sick and all these kinds of things, right? So pain management is absolutely so important, for health.
There's a lot of research. It does show if someone's experiencing more anxiety, it does increase their perception of pain. So there's a direct, contribution of that. With painkiller medication, it does not address the psychological pain at all.
Oh, really? Well, I guess not. No, it wouldn't. Yeah.
It wouldn't help you to process your emotions.
That's so true.
Wait, for a second, I was like, "Are you joking?" Take a pill.
It's like a brain fart. I need like 5 seconds my brain needed 5 seconds to process. Like, oh wait, duh.
Oh, you still experiencing a brain fog?
It's like, obviously. Yes, folks. I am a music therapist. I am slightly intelligent on occasion, and then on other occasions, not so much. But I'm doing my best.
I mean, it can be like, cause like in how, in general, how in the world like we treat, mental health issues. Are pumping people with those pills. So sometimes we do forget, we would have this illusion of like, taking some pill and your emotional, this emotion disorder, mood disorder, or other kind of like bipolar or depression, anxiety will be cured, or personality disorder will be cured. But the reality is medication only can help with some of the symptoms, or help with some chemical balance in your brain, but to really solve the issues of mental health, condition is really this, where we talk about, this emotional processing, like if it's a broken relationship from early childhood because of trauma, it's healed from that trauma, and kind of experience it and reinterpret it and transform it, give a new meaning. So but it does give people an illusion that maybe I just take a pill, I'll be fine.
And frequently the medications also come with side effects that can be even more stressful than the original condition. So it's all about looking for non-invasive ways for treatment, right? Whether that's pain, whether that's the underlying condition itself, always striving for, something that's going to have less or no side effects at all, right? And, looking for a way that, behavioral 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 ways to solve certain issues, right? Yeah, all of these things.
Yeah. Like, why did we want to talk about pain management? Is also, in the previous literature uncover, we're talking about, we're going to talk about playing instrument, how playing instrument going to make you smarter, but we decided to kind of jump ahead with the pain management because recently, I'm in Shanghai, China. China just changed the COVID policy, like in a turn 180-degree direction. So, and I see a huge wave of people getting infected and people like feeling this, extreme, like just pain everywhere. When they're infected, even like after they, their test negative again, but they still experience those COVID symptoms, and think that's also like a double pain management. There's this physical part because of the fights with the virus in your body. People experience some physical pain, but also then it's like, okay, questioning like what is happening, like why life is become so uncertain, so unpredictable, why the night before we're seeing things go one way and the next day everything's just like crashed, or my plan the next day even are not stable, and then do we isolate or do we go out, and what do we do with people who are decide in a different make a different decision, and how do we perceive that if that's our like close family or friends. And so all those stress and emotion pain just make those physical pain like just more extreme.
Yeah. All of these extra external stressors bringing on this stress that's bringing on this pain, right? There are I don't want people to think that this isn't already happening. There's already music therapists who are working in hospitals for pain management. When I was a student music therapist, I worked with my supervisor in a children's hospital, and I was on the pediatric intensive care unit with her. And one of our main goals was helping with pain management for all the children who were on the pediatric intensive care unit and also the bone marrow transplant units. And helping them, through a lot of it was through singing, having them engage in music and having them engage in singing. Because why? Because when the brain is processing music, and as we know, when we're engaging in music, it pretty much lights up our whole brain. Our whole brain is engaged, right? So when your whole brain is engaged in music, it has no room to process pain, right?
So yeah.
In layman's terms, yes. When your whole brain is engaged in music, like there's just no room for pain. Exactly. There's no room for pain. Exactly.
Play more music.
Exactly. Play more music, everyone. Okay. So we're all right. So go ahead.
Yeah, and join our Patreon if you want to, learn receive all the research paper we talk about, and also join our future guest interview. You can join, online live and have a Q&A with our guest speakers.
Yes, we recently just had a speaker, an eye surgeon from Japan who is now turned into a musician and businessman as well. So if you're so curious about how that whole process works, going from the medical field to being an entrepreneur and also musician, you might want to check out, some of our other podcasts. That's in our Music and Me, I believe. That's our Music and Me series. Yeah, but that's the kind of things that we're looking at. We're covering So please, yes, join our Patreon, and you'll find all kinds of interesting guests, and you'll be able to engage in the Q&A and also request topics as well. So without further ado, I think we're about to wrap it up here. So once again, play more music.
感谢你的收听，我们下一期不见不散。